Okay. You mentioned something about my unique background. I'm assuming that's the fact that, one, I'm probably one of the few researchers in Kansas City that was actually born in the community that we're collaborating with our research studies. I lived on 40th and South Benton for all of my childhood years, graduated from Purcell High School, but then went on to KU to get my undergraduate degree in electrical engineering, and worked in the aerospace and defense industry for about 3 years before deciding that the work I was doing on the weekend in the community was much more exciting and fulfilling than being a part of the war machine and selling aluminum sheet and plate to aerospace and defense companies. So with that, the work that our research team does, and which is the Community Health Research Group, and as director of the Health Equity Institute, is primarily focused on addressing health disparities in the urban Kansas City area. And we do that through working with a number of organizations all throughout the metro area. And let's see, can I share my screen?
You should be able to. I'll make sure. Yeah.
Let's see if we can get this slideshow. So just as John said, one of the really cool projects that we've been able to lead through the UMKC Health Equity Institute is the Our Healthy KC Eastside initiative. This is an initiative that was funded by Jackson County. They had seen some of the research we had done around COVID-19 testing that was funded by NIH with African-American churches, and approached us to submit a proposal to address the need to expand COVID-19 vaccinations throughout some of the most socially vulnerable communities in Kansas City. And they had interest in providing health services and conducting research studies to learn more about how COVID-19 is affecting our community, along with making sure that people had access to care, especially since we knew during the pandemic, many people were foregoing their medical appointments. So those were our primary goals. One, to reach out, increase the reach of COVID-19 vaccinations and access to health services. And then also to develop this really robust, unique infrastructure to address health disparities across 4 sectors on the east side of Kansas City. And those sectors included businesses, faith, youth, and neighborhood organizations. And in probably about 50 meetings prior to submitting the grant with community partners, with health partners, with anyone who would listen to this wild idea that we had, we talked with our partners about where this work should be done. And everyone pretty much said we should be focusing on these social vulnerable zip codes that had some of the lowest rates of vaccinations in the metro area. So you can see the 6 zip codes there. And 2, we knew that from our work with churches over the last decade and a half, that when you engage the community, there is so much more impact and so much more influence and so much more access that could be had, especially when trying to deliver health services. And so many of those 50 meetings we had in preparing the proposal were with churches, with neighborhood associations, with youth organizations, and with businesses, because they know their constituents. We wanted to make sure in collaboration with our partners across these sectors that we could have settings in the community that would be trusted, that were highly frequented, and also that had great influence with their church members, neighbors, youth, family, clients, customers, and anyone that they came in contact with. So our research team is really, we are sold on a community engaged approach. And in using this approach, basically based on community-based participatory research principles, we engaged our community partners and our health partners in every single phase of this project, excuse me, including helping us to set the agenda and develop the proposal, all the way through developing the initiative, implementing it, helping us to evaluate it, and then disseminating the project. And we were able to do this with a really unique structure. The structure that we built with our community partners aligned community partner leads with leads within UMKC so that they could efficiently be able to distribute funding, resources, and support through the university, while also providing training, tools, and any other support needed to our collaborative community partners. With this model too of implementation, we also had a primary focus on, again, vaccination and health services. So this project included all 4 professional schools at UMKC, University Health, the Black Healthcare Coalition, along with UMKC's Community Assessment Center that provided mental health services. Eventually, we had over 60 community partners across these 4 sectors participating in the initiative. I'm not going to introduce all of our partners, but I just always like to highlight who they are. So here you see our partners in the neighborhood sector from UMKC and from the community, in our youth sector, again from UMKC, led by a faculty member in our nursing school, along with youth ambassadors, with our business sector, with our UMKC lead being the Vice Chancellor and the Director of the UMKC Innovation Center, and then our community partner being Porterhouse KC, which is led by Dan Smith. Sorry, please ignore the puppy in the background. And then the faith sector that was led by Reverend Eric Williams and Calvary Community Outreach Network, and our UMKC Health Equity Institute Director, Carol Bo Thompson. And here what you'll see is a list of all of the different community partners and organizations that were a part of the project. One of the things that I have to mention that I didn't mention up front was that the county gave us $5 million to implement this project over the course of about, it was supposed to be 6 months, but it turned into 4 months with 1 month of planning. I am so sorry. Please give me 1 second so I can pick up my puppy and hopefully he will stop barking. All right, there. He always has to have his moment. All right, sorry about that. So with the 60 organizations that we recruited across the 4 sectors to participate in the initiative, they were able to then bring on board 160 community health liaisons that actually were the grassroots, boots on the ground disseminators of this project. They did everything from handing out flyers, talk to their friends and family, posted on social media, and they coordinated their vaccination events. Actually, each organization coordinated 2 events, one that we called our first shot event. And once they scheduled that event, the second event occurred 3 weeks after that for second shots. And then later on, those became booster shots as well. Just wanted to give you a picture of what some of our materials look like. We worked with a young graphic designer from the urban Kansas City area. He did a bang up job on our materials that targeted not only youth, but materials that were developed for, targeted not only adults, but materials that were developed for youth as well. And we had lots of feedback from our community partners on how these materials should look and feel and the vibe of them, so that it would make it easier for them to be able to talk about COVID-19 with their constituents, not be the experts, but just share factual information along with encouraging them to come out to the vaccination and health screening events. Just a glimpse of some of the activities that happened all across those 6 zip codes. Overall, nearly 13 vaccinations were given. Most of those were primarily given at University Health and a satellite location that they developed on the southeast side of Kansas City at the Cleaver Family YMCA. But a large majority of them, about 4,000 to 5,000 of those were given in the community over a 4-month period, where it was during a time during the fall of 2021 where very few people were getting vaccinated. And we were getting from about 40 to 60 people vaccinated per site. These were supposed to be smaller, more boutique vaccination sites, events, and settings, because we knew at that time vaccinations were waning. You know, there were the huge stadium vaccination events that were still taking place, and only a few people were getting vaccinated by that time. And so we really wanted these to be unique to the setting. And again, have our trained community health liaisons really be able to promote and coordinate them and get their people there. So we were incredibly excited about how many people we were able to get vaccinated. Most of the people vaccinated, as you can see here, were females, African Americans, and most of the vaccinations actually of those people who got vaccinated actually were representative of the zip codes that we were trying to reach. I just like to show this table. This was presented by the deputy director of the Kansas City, Missouri Health Department last year at a community forum, where we fed back all of this information to our community and health partners, and just wanted to, and what was indicated from the information that he shared was the fact that vaccinations had gone up in all of our zip codes. And not only have they gone up, they pretty much, except for the ages of 5 to 34 in the 64128, and except for the 35 and over in the 64129. But the point of this table is the fact that the vaccination rates increases far exceeded those that were seen citywide. And while we cannot attribute that solely to the work that we did, we do believe that the work of OHKCE really played a part in those higher rates of vaccinations, especially when we started. These zip codes had some of the lowest vaccination rates in the urban Kansas City, Missouri area. Just wanted to highlight 3 of our top events and just show just the power of community, and especially too in bringing the business sector into a health-focused initiative. So you can see that the Casey Daiquiri Shop at Happy Foods vaccinated 61 people in the parking lot. People were lined up to get vaccinated. The other thing that we held at these events were surveys where people could also get paid to complete a survey. And people could get paid $50 to receive their first shot. But just really incredible that at these really small events, we could get so many people vaccinated because of the power of the boots on the ground, people equipped with resources and materials to reach out to those they knew best. We were also able to provide over 4,000 health services. These were blood pressure checks, blood glucose screenings, mental health screenings, dental assessments, HIV and STI screenings were also added later, along with linkage to care services. To be able to pull off delivering so many health services across these events, and I should mention that there were 117 community events that took place. Took an amazing effort in having pharmacists, physicians, nurses, dentists, and dentist hygienists available during these events, and being able to have folks who attended these events talk with them about their concerns about vaccinations, talk about them with some of their health concerns, and be able to get information right there on the spot. I did just wanted to highlight a couple of the health services that were just really incredible. Our dental school was able to screen, probably at least 5,000 people or more. But with that, they were able to give 358 dental referrals and be able to complete at this time, it's up to about 300 dental appointments where people have received treatment in the dental clinic at UMKC. And then also related to STIs, they were able to complete over 300 tests. And this was and they only started doing the STI test probably in the third of the fourth month of the implementation of the project. But once they started, and they did give people about $50 to get an STI test. But once they offered those services, people would be lined up to get tested for STIs. I remember I had a woman, she had to be about 60-something years old, and she was like, where do I go and take that sex test? And I can't believe we have these services available right here in the community. And that was at an event that was held at Sunfresh on Swope Parkway, right by Swope Health Center. So then again, I'm trying to emphasize just the incredible amount of not only services that were delivered, but the value that the community saw in this work. And again, provided by our health providers, our faculty. We had over 300 student volunteers across these 117 events. And as I mentioned earlier, we were able to administer surveys for those who came on site. Each organization could have about 100 to 150 people complete surveys and receive $50 to complete those surveys that focused on COVID-19 health beliefs and behaviors and some lifestyle behaviors. And so incredibly, we were able to survey almost 3,500 people. We'll go over all of these survey participant characteristics, but I will highlight the fact that, again, primarily those who completed surveys were African-American and females. When we asked them why they wanted to be vaccinated, not surprising that they would say family and they wanted to keep themselves safe. But third after that was that they wanted to keep their community safe. And then when it came to health, what we saw was that there were almost 25% of people who had postponed their medical care during the pandemic. Almost 30% reported that they had hypertension, high blood pressure, and over 20% reported that they have been diagnosed for depression. And so just really astounding the amount of health burden in our community. When it comes to social determinants of health, we found that about 40% said they didn't have enough food in the past year. About a third had lost their income during the pandemic. And over 20% had challenges with transportation. What's not here is about 19% said that they did not have consistent access to broadband internet services. So something of note for that. Then we always make sure that whatever we're learning, we feed that information back to the community. So last year, we had a community forum where we brought together all of our community health liaisons, our health partners, the researchers. Maybe another time I can talk about the research studies that were done during this project, and talked about the success and findings of the project. We also held focus groups during those community forums and learned from the participants that the primary health priorities that they saw in the community that were needed were diabetes, a focus on diabetes, high blood pressure, and mental health. And this was not surprising considering the information that we learned from the community-wide survey. And the strategies that they suggested that were needed should focus on health education and literacy, connecting folks to medical services, a focus on lifestyle behaviors like nutrition and exercise, and the need to continue to grow opportunities to build trust with healthcare systems and reduce the cost of care. So just some quick lessons learned, increasing the capacity to co-locate health services in the community setting really can be critical in addressing health disparities and the burden that we see in our inner city, Kansas City area. Having those health professionals available where people can talk to them, have them face to face, ask their questions, dispel myths about vaccinations, get some understanding on some of their health conditions and get referrals to medical services was just really amazing. We have a catalog of stories that we collected from people just in their experience and the value of their attending these community clinics. The The double benefit is the fact that we were able to not only increase the uptake of these services, but collect a bunch of information around health behaviors that we're using to shape many of our upcoming projects in the east side of Kansas City. I always have to say community partners need to be paid and we need to feed them. And we made sure that we did that from an equity standpoint and celebrate the progress as we went along. So just a quick glimpse of what's coming up. We've recently been awarded another $5 million. That resolution was passed last year by the Jackson County legislature. So with that $5 million, it'll be awarded over a 1-year period. This rapid approach to developing projects with a very short timeline seems to be the norm with this work. But we will be focusing not only on vaccinations, but also in health and providing health screening services. But also we want to focus on more preventative health services. So cancer screenings and referrals will be included, along with the development and implementation of diabetes prevention programs that will be available across the Jackson County community. And we'll also have a focus on infant mortality to be able to provide reproductive services to women in our community. I won't go through all of that. And for this next phase of the project, we do plan to expand beyond those zip codes. We will be looking at including more community-based organizations, especially youth organizations. We know that there is still a real need for more youth to get vaccinated. And so we hope to be able to achieve even more vaccinations with the youth population with this round. We're also including more special populations like Spanish-speaking populations, refugee populations, and homeless, which you don't see here. And we've already started seeking additional funding because our goal is for this work to continue whether or not we have funding from Jackson County. We've developed an incredible network of community and health partners, and we want to be able to continue to increase the capacity of our partners to do this work. So I think I will stop there.
Well, thanks very much, Jannette. That's it was a really spectacular outcome for the project kind of under the gun, so to speak. To get so much done within such a short amount of time was really remarkable. It certainly positioned you for doing the next $5 million, which is happening now. Could you maybe say, because of the kind of the background of this group, could you say a little bit about the digital inclusion aspects that you'll be looking at as we go through the coming project?
Sure, yes. So I think I mentioned that from our community-wide survey that we implemented, one of the things that we learned was that nearly 20% of the folks did not have consistent access to broadband internet services or a home computer. And so we know that access to these types of technologies and devices are really critical. We saw that during the pandemic when many people who did not have this access could not get vaccinated because they couldn't get online to schedule appointments, or even just the difficulty in the process and completing the information that was needed to register to get vaccinations, and for some, even for COVID-19 testing. And so we really see as a critical need to be able to provide people with access to digital services, to devices where they can make those connections, not only to be able to access more health information, but also to do something as simple as look at their electronic medical record. One of our other survey questions on another study that we've asked about is how many people have ever accessed their medical records. And there were about 20, almost 30% of folks who had never done that. And so we know that that's a really important step in being able to access healthcare and being able to really guide and have, patient-centered care is for people to have, access to their records.
Yeah, I think this group is really kind of sensitive and aware of social determinants, but it does bring it back home again when you mention that you're finding 20% of people have no connectivity really whatsoever. That becomes a real challenge for the kinds of things that we try to promote, which is, the ability to reach out into the community and have technology make a difference in someone's life. It really brings home the point when you say so many people are still without.
Absolutely. And so with this next phase, we are looking forward to working with KC Digital to be at the events. We're planning 32 events this year that will take place across our 4 sectors. We're really encouraging the sectors to partner up so that we can have events that may have a church and a youth organization involved, or a neighborhood association and a business involved. And we're looking forward to having KC Digital being at those events to not only provide information on how people can get support in accessing internet services, but also to provide some of that digital health literacy that's so needed in our community as well.
Yeah, we're really looking forward to that. That's great. Let me turn to some of the questions that we received in the chat. Just a second here, please. The first is, how are you tracking the individuals reached through your efforts?
We have a system set up where for everyone who gets vaccinated, and these systems are already developed to some extent. We've just tailored them for our initiative so that we know who's getting vaccinated. We do have some demographic information on these persons. And then we also are doing the community-wide survey. Because of the very short timeline of the first phase, we were only able to do the survey one time. But we're hoping that with this next phase, when we implement the survey again, that many of those people will come back and complete the survey again so that we can see if there are any changes over time. The other thing is that we have all of these data tracked by zip codes. So we're able to look at where the burden of health conditions or needs are within the zip codes for those who have completed our surveys or those who have been vaccinated.
Great, thank you. David, did you want to embellish your comment at all?
Well, not really. I mean, the capability of all of the providers to use cellular phones to access the record is there. So it shouldn't require broadband, but I know that data caps are a significant limitation for visits, virtual visits and things like that, but that shouldn't interfere with patients being able to just download an app or access the web page on their mobile devices to get access to their records. The education of both providers and patients is problematic. I mean, that's where that's where it is. I mean, almost every patient I go into and see who has a smartphone, then, and over 90% of our patients, no matter what their income level, have smartphones. But many of them are totally unaware of the fact that the portal even exists and are utilizing it. And when you sit down and show them how to do this, they're surprised at how easy it is. But I don't think most healthcare institutions are making a concerted effort on getting their patients enrolled and teaching them how to use the portal effectively.
Yeah, and that's part of what KC Digital Drive will be helping this project with, is exactly that, is to try to create that bridge of innovation or of connection. I'm sorry, David, if you wouldn't mind introducing yourself. We missed you the first time around. You had to join us later.
Yeah, I was participating in Dr. Spertus's research, but I'm a family physician at University Health at Lakewood and an associate professor at the UMKC. And try to help the community in family medicine with a whole bunch of research projects, as well as having fun with patients. I'm working part-time, so I have a lot of time to go on to projects and have some fun.
Great.
Hey, David, good to see you.
Yeah, nice to see you again. Yeah, we didn't get that PCORI grant because the Apple Health thing had no efficacy demonstrated. So researchers said you can't do efficacy studies if one of the arm of the study has no efficacy. So we're now scrambling to actually come up with an NIH proposal to study and demonstrate the efficacy so that we can go on to do some other things.
Well, let me know if you need me to.
Yeah, we definitely
with you.
want to have you involved as a consultant and somebody who could really guide us, because we certainly are targeting the same community that you're reaching out to.
Yeah, I think the sectoral approach of this project is really part of its power and why it's been successful so far. And I see that going forward. Isn't that right, Jannette?
For sure. As a matter of fact, we just had a full afternoon meeting at the KC Porter House with all of our community sector leads, and just really tried to spend some time in mapping out how and when the events will take place this year. Although the legislature has provided the resolution and the vote for the funding hasn't come through just as yet. As a matter of fact, I think the county should be voting on their budget next week. So we're hoping that soon after that, we'll be getting ready to get started. But the great thing is, because our community partners are so vested in this work, we've continued to meet, we've continued to plan so that when the funding does hit, when the contract hits, we'll be able to hit the ground running.
That's great. Other questions for Dr. Berkley-Patton? Paul, did you want to say a little bit about what's happening with Mark?
Sure. And my name is Paul Bashar. I'm with Mid-America Regional Council and within the Research Services department here. And yeah, since last year, there's been an explosion really in people needing access to data sets that show affordable or accessible broadband. And so there's a number of activities that were going on right now. There's FCC has a BEAD program that's doing stuff with broadband, and there's actually a data kind of review portion that's going on with that, where there's going to be monies made available to local or ISPs to improve broadband access or affordability. And so there's that activity. There's also, we have a bi-state corridor reinvestment here in Kansas City, where we're looking at, assessing that as well. So yeah, there's a number of these data sets that are coming out that might be helpful to ascertain, either where it is or how good it is.
Okay. We may be back in touch then. Certainly, we're going to be using the FCC's Affordable Connectivity Program as part of what we're promoting in Dr. Berkley-Patton's community events. So those data sets are really very important.
Yeah,
Okay.
if you do a search for the FCC broadband map, it has it all laid out there. So
Okay, great. Thank you.
Yep.
Other comments or questions? Well, Jannette, thanks so much for this. It really is so important to our community to see these kinds of things take off. And as I said, it's remarkable how quickly you energized quite a large sector of the community to make this happen. And it's really exciting to be joining with you as things move forward.
Well, thanks for this opportunity to share some of the work that we're doing. We've drank the Kool-Aid on. You cannot do this work without community engagement. And full engagement means not just asking their opinions, but really having them be a part of the process from the very conceptualization all the way through dissemination. Well,
we certainly view ourselves as one of your community partners. So please, you're welcome here at any time. And including if you want to stay on this morning, we have a solution that's looking to do outreach to the homeless in particular, and you might find that interesting as well.
Way cool. Thanks, you guys.
Thank you. Paul Bouchard and Dr. Varan joined us after we started, and they have gotten a chance to introduce themselves. Is there anybody else that we've missed along the way before we start off into our next presentation?
Yeah, I guess technically I joined pretty late. So Jim Starso, I'm part of the KC Digital Drive team.
Great, thanks, Jim. Okay, let me introduce Ayan Puri. Ayan is a student in Wichita and has done a remarkable job of getting support for a solution to help connect people to virtual visits with their practitioners. And in particular, it allows practitioners to volunteer time where they may have found it not convenient or possible in previous circumstances. So I'm eager to hear more about that work. Ayan, please lead us through it.
All right, thank you so much, everyone. Thank you so much for giving me this opportunity to speak with you all today. Let me quickly share my screen. All right. So as Mr. Fitzpatrick said, MedicAll is a community-based platform that offers free telemedical consultations, specifically to impoverished patients by utilizing volunteering healthcare. Obviously, we're not just looking at homeless people, we're looking at generally the impoverished. Able to hear me?
There's a little bit of a break in it, but we can hear you.
Okay. Perfect. As I said, MedicAll is this program, and we're looking to, we haven't launched yet, but we're looking to expand.
Oops. Lost. Ayan, maybe if you went without video, the connection would be a little bit better.
Okay, sounds good. All right. Yeah, so before talking about the actual program in detail, I kind of wanted to talk about the inspiration behind what kind of fueled the motivation to create this idea. So there were two main ideas that we wanted to achieve through this nonprofit. First of all, was to make healthcare more accessible, specifically to impoverished individuals. So through this telemedical platform, we're able to ensure that people can get access to healthcare with very quick availability. And we do that using our volunteering healthcare professionals. And secondly, we wanted to make volunteering a lot more convenient. So I'd spoken with a lot of doctors, a lot of people in the healthcare industry, and a lot of people have said that they wanted to give back to the community. They wanted to have that opportunity, but they simply didn't have the time to allocate, say, 6, 7, 8 hours on one day just to volunteering. So essentially in our platform, what we're able to do is we can allow these healthcare professionals to allocate 15 or 20-minute slots to volunteering on this platform. And that ensures that they're able to, that they can volunteer in quick segments without having to allocate a lot of time towards just volunteering. And that allows them to obviously see more patients and fit it within their schedule as well. So essentially, a patient, they'll go onto our platform and they'll book an appointment. So all the times that are available to them are times that volunteering healthcare professionals have already dedicated. So say a doctor says that I can volunteer on Tuesday from 7 to 7:30 in the morning, then that is one available time slot that that the patients could choose from. And then during that meeting itself, once that connection happens, the healthcare professional, they'd create a medical report, including the diagnosis, conditions, further action, any tests that need to happen, any referrals, in general, future steps. And then, of course, that'll be implemented through our partnerships that we've made with free clinics, with all these other partners that we've established, that actually can ensure that the follow through of the consultation actually happens. So this is kind of a list of these core partners that we've dedicated. So on the right side, these are all the organizations that provide their services through volunteering healthcare professionals. So the WSU PA program, the Kansas School of Osteopathic Medicine, then Ascension Medical Group, and other local MD groups. They've essentially dedicated time where they'll say that as long as they're student associations, then their students with a supervisor, they'll essentially volunteer their time. And then of course, for the students, this is also very beneficial because they'll be getting that experience of how to conduct telemedical consultations. All that stuff is included in part of their training. So that would be kind of a good conjunction of both of those ideas. And the ICT street team, we're essentially looking at them to kind of implement, to spread the word of this nonprofit to the populations that we're trying to target. And on the left side, these are all the ways that we kind of execute our actions. So we have partnered with 4 local free clinics in the Wichita area. So as I mentioned previously, all of our tests, referrals, or not just referrals, but also prescriptions, all of these would actually happen at the free clinics that we've partnered with. So we just refer them to the free clinics, and that's where we're able to get this execution from. We've also partnered with local libraries. So this partnership is for any impoverished individual who doesn't have access to telemedical communications like a Zoom call through their phone or a computer. So most of the research that we've done shows that they do have at least access to get onto a Zoom call through their phone. But as I said, if they don't, we have a partnership with these local libraries that allows these impoverished individuals to use the computers of libraries. Then we are fiscally sponsored by Nonprofit Go. Nonprofit Go is a local Wichita, it's an organization that essentially helps nonprofits establish themselves. So we're fiscally sponsored by them, meaning we have all the advantages of a 501c3 without actually being a 501c3 right now. And just a couple of weeks ago, we submitted to file for a 501c3. So we should hear soon about, or get an update about that very soon. And then Novus, this is one of the companies that has agreed to white label our services once we do launch. So essentially, we can integrate the services of MedicAll onto Novus, which is a business that essentially provides services to people facing substance abuse issues. So using that, this can also serve as a potential revenue stream. Of course, being a nonprofit, all the funds would just go right back into the organization. And then lastly, Folsom Skyfkin, we've partnered with them. And it's more of an informal partnership, but they're a law firm, and essentially to conduct a lot of the law reviews, the legal overview, we consult with them just to ensure that we are meeting all the requirements. So this is a rough sketch of something that our website would look like. So this is if a patient, if they went onto the platform, they would essentially be able to choose a time, choose a date and time. As I said before, these are based on the availabilities of the healthcare providers. Then you just fill out some basic information, fill out a symptom form, just any other general forms that would be included in this. And then they'd get a confirmation email, and then using the email or phone number that they've provided, us on the back end, we would send out a Zoom link to both the providers and the patients. So as I mentioned, where we spoke extensively with a lot of healthcare clinics, and a lot of them had tried doing telemedicine before, but a big issue they kind of ran into was a lack of follow-up. Many people, they would commit to a time and then not actually show up to the meeting. So to prevent that, we've ensured, or we've created a model where a day or two prior to the actual meeting, we send out a message to both the provider and the patient, and only if we get confirmation does the meeting actually happen, just to prevent the wastage of time for either party. So now on the side of the healthcare professionals, so they would essentially sign up. So any healthcare provider that wants to volunteer and is not associated to a partner organization, they would just fill out this form, and then on the back end, we'd reach out to them, get their state licensing numbers, ensure that they actually are fit to volunteer their time to this nonprofit. And then they would provide their availability within a monthly frame. And then essentially we would figure out a way that they could be implemented onto our EHR and start providing services thereafter. And then, as I said, we have a lot of other partnerships with Ascension Medical Group, with a lot of other student organizations. So if they are coming from one of those partnered organizations, then we don't necessarily have to get all that licensing numbers, because that's kind of what our partnership with them streamlines that process. So a lot of questions that that people generally have regarding this is, what liability would the healthcare provider actually have? So in Kansas City and Missouri, essentially any volunteering physician or healthcare professional, they are protected. They don't have liability as long as it is volunteering, which is what our services are doing, of course. And in addition, in order for this meeting to actually happen, the patient would have to sign a waiver form that essentially be saying that the doctors or the healthcare professional, they can be held liable in any situation and can be sued as a result. So this is board by a pretty good board of advisors. So Dr. Ryan Spalding, he's the director of telehealth and telemedicine at KU Med. Then Mr. Basil Harani, he is from the local Wichita community, and he has a lot of experience with the IT sector, specifically in medicine. He's created a lot of companies with it, so he's on as kind of an advisor for that specific purpose. Then Gabrielle White, she's actually the principal of the school that I go to, but she has a great way to connect to the community, and therefore I think she'll be a very valuable member on this board of advisors. Rhonda Henman, she is the director of the WSU PA program. So essentially just to ensure that we are meeting all requirements, to see how we can specifically work better with school organizations. That's why we've included her on the board of advisors. Dr. Jim Walker, he is a local anesthesiologist and does research at Via Christi, but he has a lot of experience with helping nonprofit startups, just like mine, kind of getting off the floor and seeing how to scale them, grow them to from city to state to all around the nation. So we have him on. And then Robin Chadwick, she is the COO at Via Christi in Wichita. So she obviously has a lot of experience with connecting doctors to these healthcare professionals. So she's a very valuable member on our board of advisors. And lastly, Sharon Allen, she's not on the board of advisors, she's just on as general counsel, but she is the executive director of the World Telehealth Initiative, which kind of has a similar goal than compared to Medic-All. So she has a lot of experience. She's like the head of a very successful initiative. So she's a very valuable member of our board as well. So just some future steps for Medic-All, where we are right now and where we want to go in the future. So right now we have some initial funding from the Kansas Health Foundation. They've been gracious to give us a grant, and this money is enough to kind of sustain us for the short term. We're able to launch with our website and all this stuff with the funding that was provided. But of course, we are looking for ways to continue to expand, and I'll get kind of into that a bit later. So that's one part. Just receiving additional funding would be very valuable for this nonprofit. Second of all, we want to partner with an EHR. So I've been meeting with a lot of EHRs, EMR programs lately, and I've honed it down to 2 to 3 that I think that could be used for Medic-All. So within the coming weeks, I'll kind of finalize this deal. So in a way to ensure that it is cost efficient and will provide the best services for the nonprofit. Then we want to conduct a local telemedical day in Wichita. Essentially, this would be just to spread word of this nonprofit to individuals in the local community to see how it can be used. And then lastly, as I mentioned before, we want to white label to companies serving similar populations, essentially just integrate our services onto their platforms. And as I mentioned, this can also be a revenue source for this nonprofit. So once that is done, once these 4 steps are met, then we can launch our website kind of with our MVP, our minimal viable product, and then expand this project to other states and see how we can kind of scale it to help more people. So there are kind of 2 areas of growth that I really see with this nonprofit, of how we can really make this most effective for the people we're trying to serve. So first of all, we want to grow. So as I mentioned before, actually, I should mention before that most of the partnerships that we have, the majority of them are in the Wichita community. But the way we've set up our nonprofit or our platform is that really this can happen anywhere, anywhere right now, really only in the state, but as long as we have patients and free clinics in any city, we can provide services from anywhere in the state. So if we are able to get more free clinics in the Wichita and Kansas City area, who are willing to kind of take in these tests, prescriptions, fill referrals, or get referrals from Medic-All, that would be very valuable for the people that we're trying to serve. Then second of all, volunteering healthcare professionals. We want more professionals that will obviously be willing to volunteer their time. We do have a lot right now, but more is always better because we're able to ensure that we give the maximum availability to our patients. Then homeless or impoverished care-centered organizations. So as I mentioned, we have a partnership with the ICT Street Team that would essentially push out this service to the populations that we're trying to serve. So if you could find more of these types of organizations in the Wichita and Kansas City area, that would be very valuable, not only to the nonprofit to provided services, but also to the populations that we're trying to help, more importantly. Then, as I mentioned, we're looking to partner with an EHR. So we're still looking for if there are any better options than the ones we've currently selected. So that's where we're looking for some partnerships. Lastly, white label companies, companies that are willing to white label our services. We're actively seeking out companies that would be willing to do this. And lastly, general counsel, any people that would be willing to serve on our board of advisors or just be as a general advisor, informal advisor that would be able to counsel us and advise us on how to scale, how to grow, just overcome any obstacles that we might come over in the future, in the near or distant future. And then lastly, in terms of funding, where would any funding that we receive, where would that go? So first of all, probably the biggest cost that will entail as a nonprofit is our EHR, the electronic health record, getting that interoperability that has a high cost and can sometimes even be per provider. So a lot of the funding would be directed towards this. Then for the website, the domain and development, that is for the most part that is already done with the grant funding we've received from KHF, but the monthly operational website costs that will also be included with the funding. Then more legal work. So as I mentioned, a lot of the legal work that we have right now is pro bono. We're not like paying for any of that, but in the future, once we get more into it, more involved, then we probably will have to find ways for that. So that's where funding would go. Then hired work. So as we launch, we want to hire on obviously a part-time operational manager just to oversee the launch, kind of break down where potential inefficiencies could come up, all that stuff. So an operational manager, that's where some of our funding would go. Then lastly, advertising and increasing our reach with kind of both sectors, both parts of this to our impoverished individuals and healthcare providers, essentially finding ways to spread word to them. And that would obviously be minimal funding, but would still be part of it. So this is my contact, ayanpreek@gmail.com, and my number. So I would obviously love to answer questions right now, but if you'd like to reach out to me later, these are my contacts, and I'd love to speak further about this. So please let me know what questions you guys might have.
That's great, Ayan. Thank you so much for sharing that. I'll just jump right into questions. Teresa, would you like to ask your questions in person? I see that you posted some in the chat.
Sure. Yeah, having worked with the healthcare access programs in Kansas City, so WIJO-Care, Northland Healthcare Access, and Metro Care, which some of these, from a technology standpoint, have laid in different solutions and are looking at new solutions. Have you worked with Project Access there in Sedgwick County? Because they have a partnership that have initiatives not directly on point with what you're doing, but might be a good extension of what they already are doing.
Okay, I have not yet, but I'll definitely look into them. You said Project Access?
Yes, yeah. So
Okay.
if you look up Medical Society, Sedgwick County, Central Health, I put that there in the chat. If
Okay.
you look at that link, again, they're doing some good things, and they already have a whole network of providers within health systems and individuals that are already volunteering their time. And
Okay.
so you may be able to plug in with them to say, okay, let me help you with the scheduling component of this.
Okay, definitely. I'll definitely look into it. Thank you so much.
Great. The other thing is, having worked with a lot of the United Ways, both regionally and nationally, looking at the ICT program collaborative that you did mention in your presentation, United Way there does, in fact, host that. They use an HMIS system, so Health Homeless Management Information System, called Client Track. It's from Ecovia. And in fact, tomorrow night, they're doing their point in time count. So tomorrow night from 5 to 7, they're in Sedgwick County and Wichita. So they will be inputting that information into that tracking system. And then on an ongoing basis, they monitor those individuals, as you can imagine. Plus,
Okay.
on the 211 side, they use WellSky, which is based in Kansas City, their community services platform. It used to be called Shelter Point and Service Point there. So that in this case, it's Service Point because Shelter Point was the MHIS system. So that's another way to go with United Way there. But I'm glad to hear that Kansas Health Foundation is in the mix. If you need a resource there, because a lot of times on the homeless side, they also have substance use disorders and mental health conditions, had worked with Valley Hope for several years, actually brought Valley Hope on their virtual behavioral health platform here to KC Digital Drive, probably what, 3, 4, 5 years ago.
Yes.
So there are definitely some telehealth and telemedicine type solutions that you could avail yourself to as well.
All right, awesome. Thank you so much. I really appreciate it.
Thank you, Teresa. So, Ayan, there's still a manual side of this, and that is actually doing the scheduling of appointments. Is that right?
So the scheduling, all that happens just via the platform. The only thing that is manual is like sending out the links and stuff like that.
I see.
Yeah.
What sort of service are you using for messaging? I found that very interesting that you'll be able to send out reminders.
So yeah, that would actually be part of the manual thing. We would be manually sending those messages out via the information that we get from the scheduling.
Okay.
Yeah. And then like in the future, we'd hopefully look to automate that process. Initially, I think it would be a bit doing too much. But as we continue to grow, hopefully we can automate that process as well.
Okay. Do we have any other questions for Ayan? Tell me a little bit about why you decided to work as a not-for-profit.
Okay, yeah. So I think the best way that this would be implemented within the community would be as a nonprofit. If we did it for profit, I think there'd be a lot of issues with kind of paying the healthcare providers. I don't think a lot of the providers would see it as volunteering if they were like, if there would be a for-profit part of it. So I think we're able to best serve our mission to provide services to the impoverished individuals as a nonprofit instead of a for-profit.
Okay. A little bit talking to Teresa's question. Have you been in contact with the Medical Society in Wichita?
Yes, so I briefly contacted them. I think I have a presentation coming up with them as well sometime in the future. So I have been in contact with them, and I think we're going to speak with them in the near future as well.
No, that's great. That's great.
Thank you.
Well, I'm glad that we had a chance to look at this today. It really is a kind of a new approach, and I particularly like the fact that it allows someone to volunteer their time more readily because they can do it in kind of digestible chunks rather than having to take a half day or a whole day out of their schedule to be able to do it. That's really, I think, very creative and should really pay off in the end. And I hope that you find that.
Yep, definitely.
Well, thanks so much for being with us, Ayan. We would like to invite you back for any further events here, and maybe some point in the near future get a bit of an update from you about how your rollout went and how things are being used.
Yeah, definitely. I'll definitely let you guys know how everything plays out. Thank you so much for your time and giving me this opportunity to speak with everyone today.
You're very welcome. Thank you for being with us.
Thank you. Have a great one.
So with that, I'll wrap things up for this month. Thank everybody for showing up. We had a really great representation today and very happy to see everyone after the holidays. And we'll be sending out shortly a message for our scheduled events for February and look forward to seeing you all again. So thank you so much and have a great week. Bye now.
Take care.
Thank you.
Thanks all.
I know.